it's a condition that they're born with. I think it's just been under-recognized because we aren't, in our profession, we're not looking at a bunch of kittens that little and looking at them that carefully. And when you do, you see it.
Hello, and welcome to The Vetrospective. This is your host, Dr. Michael Kent, and today we'll be talking about kittens. What do you think of when you think of a kitten? A small ball of furry fun? Soft and cuddly? Well, you'd be right. But they're also a bit fragile compared to their older selves and have special needs. They also face medical problems that are more common than in full-grown cats. And we're going to talk about this and maybe why kittens are different than puppies a little. And we need specialized care and equipment to care for them. While we do not have pediatric experts per se in veterinary medicine, our guest today is about as close as you can get to one. I wanted to welcome Dr. Karen Vernau to join us today to talk about kittens. Dr. Vernau is a clinical professor of neurology and neurosurgery and is a member of the Access to Care Service at UC Davis. She graduated from veterinary school from the Ontario Veterinary College at the University of Guelph in Canada, and she did her residency in neurology here at UC Davis, where she then stayed on as faculty. She has an interest in feline neonatal medicine and strives to improve the health and welfare of kittens. Thank you, Dr. Vernau, for joining us today.
Thank you for having me, Dr. Kent. It's nice to be here.
Thanks. So my first question for you is one that I pretty much ask everyone. So What got you interested in veterinary medicine?
Ooh, veterinary medicine. You know, I grew up in a household with a single mom and my sister, and she just had a lot on her plate, so we could never have pets. So I was kind of drawn to my friends and family's pets, and I loved them. So I loved them and wanted to have them and wanted to help them in life. So that's kind of what got me started. And my grandmother always wanted to be a veterinarian, but at that time, women couldn't go to veterinary school. So I think she really inspired me to do that and to try and make a difference.
That's really cool. And then you've obviously become a neurologist. And why neurology? I always ask, I'm always interested to know why someone chooses a particular area of veterinary medicine.
I am one of those weirdos that really liked it at school. You know, I went to school at OVC, and our professor was French, so we sort of learned neurology in half French. It was just really fun, and
the Ontario Veterinary College, right?
It's in Guelph in Ontario.
Yeah. Okay.
So English speaking, but she was French.
But she was French speaking.
Yeah. Yep. She was hilarious. So it was really fun, and I loved all the puzzles and putting it all together. And it's nice liking something that other people don't like. Right? Yeah. You must feel that sometimes.
No, I mean, I'm an oncologist, and people think that's odd sometimes. So, but for me, it's my passion in my life, right?
And it's a lot of physics probably for you.
There's a lot of physics in radiation oncology, and I actually have always liked math. I've liked physics, and, it allows me to bring in my two backgrounds, in a sense, my love of medicine and my more, physics, mechanical type side too.
Yeah.
So I know you've been fostering kittens yourself for more than 10 years, probably a lot longer now. And is this what sparked your interest in feline pediatrics and neonatal medicine? What drew you to that?
Yeah, my kids were in middle school, and they decided that we should foster kittens, which I thought would be easy, right? Because I'm a veterinarian, so I should know how to do these things. But quickly learned that there were a lot of things that were outside of what I knew, so I had to learn. So I had to look and see what is known about, upper respiratory disease and kittens, and realize there wasn't a lot, that people there's not a lot of clinical research done on kittens, so there was a lot of anecdotes. So that just kind of pushed me to figure out, how best to do things for kittens. And I think kids keep you honest.
Kids keep you honest. They're going to ask you the questions, and if your answer's not there, why, Mom, right?
Our first round of foster kittens went to get spayed and neutered, and I'd screwed up and said that one of the kittens was male when it was female. So they've never let me forget that. But it's a learning curve, right?
Yeah.
So I loved doing it and realized I didn't know a lot about it. So I had to learn more.
And like you said, it isn't an official specialty at this point, and we don't necessarily have all the knowledge we need to tackle the particular problems of kittens. So it was the identifying the problems and then going back and saying we had to learn more. Huh? That's
Yeah. Yeah, it was like individual, like what's the best way to do this? And, well, there's no evidence to help me make these decisions. And then we work at UC Davis where we have a large kitten caseload with the students, with their rescue, the Orphan Kitten Project, and it just kind of grew from that.
So why aren't kittens just small cats? Like, what makes them different? And why are they? Why are they not just cats?
Gosh, that is a loaded question.
It is.
There's a few things. Most of the kittens we're dealing with are born outside to feral animals. So they're not vaccinated. They're exposed to the elements. They may not have ideal, nutrition. Gosh knows what they're eating. Exposed to lots of infectious disease. So they're kind of in a tough state. So that's different than what we're used to with our inside cats. And they're young animals, so their immune system is not mature. So I think there's a lot of reasons, why they're different.
Yeah, and then I know you're acting as faculty advisor and help with several access to care initiatives here at UC Davis, including the Orphan Kitten Project and our fracture program.
Yep.
Can you tell me a little bit about what the Orphan Kitten Project is and what it hopes to achieve, and a little more on that?
Yeah, I love the Orphan Kitten Project. So I kind of got roped into that as being their faculty advisor, more than 10 years ago, which I didn't want to do because I felt I was too busy. But it's probably one of the best things I've done as a faculty member. They're a group of students at UC Davis. So they're veterinary students who run their own nonprofit. So they're a 501c3. It was started in the 80s by Julie Levy, who's kind of a famous
shelter vet
now at Florida. So
University of Florida.
Yeah, she started when she was a vet student, and it's been going. What's my math like? More than 35 years. How's that?
Fair.
So they aim to improve the lives of kittens, but their emphasis is kittens with medical needs. So neonatal kittens and kittens that have medical issues because they're vet students. So they foster them, or they foster them one-on-one with a community member. Try and sort things out, get them well, healthy, fully vetted, of course, spayed and neutered, and then they go up for adoption.
Great. And then how many kittens a year is OKP, or the Orphan Kitten Program, kind of helping each year? I know it's an incredible number, but I want to hear more about that.
It's going to vary a little bit from year to year, but it's over 600 for this year, which, is a lot of kittens, especially those that have medical issues.
That's huge because those kittens otherwise would probably die.
They take a lot from the community and our local shelters. So they do that. They do a lot of work with community members, with children in the community and their groups working with the community. So I think they do a lot of the work with kittens, but also with community members too.
Yeah. So if a vet student takes one of these kittens in, what kind of commitment are they making to get this kitten through its earliest weeks sometimes?
Yeah, sometimes, as a newborn, it may mean that it means, 12 or 16 weeks of care, getting them through, all the early husbandry and feeding stuff, getting up every 2 hours to bottle feed them, through weaning period, all their vaccines and, deworming, spay, neuter, microchip, all of that stuff, and then finding a good home for them.
So I know you said your kids keep you honest, and one of the things we have to do is we try to do evidence-based medicine, right? And you said there's not a lot there. So what about for husbandry? What do we know about that? Have you done research in this area? It's a leading question because I know you have. So can you tell us what you found about how to ideally raise a kitten, a neonatal kitten?
Yeah, we did some early work, which I'm embarrassed to say is not yet published, looking at an incubator, trying to see if, keeping them at different temperatures in the incubator would reduce the amount of, feeding or volume that they needed.
So not every 2 hours, maybe you can go to every 4 hours or
and
something.
Maybe
you could sleep through the night.
Maybe the foster could sleep through the night.
Yeah.
Yeah, and it does, having a warm environment for them to be did make a difference in their food conversion. So that was a good.
So what's like a good temperature to keep a kitten at? Like, should they just be, if you keep your house temp, like our heat's often at 65, is that too cold?
65. That is cold. Usually about 85 to 90 for neonatal kittens. They can't thermoregulate, so they need warmth. And it doesn't have to be an incubator.
Yeah,
But it
if
could
they're
be
neonatal, they don't have their mom there,
right.
probably. If you're taking care of them, it's because they don't have a mom.
Exactly. Yeah.
Yeah.
Usually we're taking, orphaned kittens or whatever. They're kittens without mom. So yeah,
Yeah.
they need warmth and they can't
They
make that
can't
up.
cuddle up to mom and they can't make the heat themselves. So that's why they need to be so
No.
much more warm than we might keep our houses.
Right. Unless you want to carry them around on your chest underneath your jacket.
Well, I might want to do that, but that might interfere with work sometimes too. So it's hard. It's a lot of commitment for anyone in the OKP project to raise these 600 cats. About what percent are usually neonatal versus, when they're a little bit more, independent?
Yeah, I would say it's going to vary every year,
Yeah.
depending on, the fosters who sign up. Neonatal kittens are hard for vet students to have because they
Yeah,
have
they're in
class,
class.
and they have lab, so those take up a lot of time. But with community members, they have about 20% are bottle babies, which may not be newborn kittens. It may be they're 2 weeks old, so they may need to be fed less frequently.
And when do they go to solid food?
About 3 to 4 weeks. It's a process. They don't instantly start eating magically. They've got to learn how to eat.
Yeah.
So that is a really important time too, making sure that they're eating and they're not just slurping their food and pretend eating.
And I cut you off a little bit. I'm sorry. Because I got excited with the next question. So what else have you learned about raising neonatal kittens that surprised you or otherwise we didn't know about and you found out through some of the research you've done?
I think, let's see, how do I answer that? I think husbandry and nutrition are really important. And I knew that, but
Yeah.
we can see a lot of issues with kittens, especially sick kittens when they're cold or they're just not eating enough. So I think those kind of strategies with husbandry, weighing them every day, weighing them in grams, and all those things are really important for observation.
And why weighing in grams? I have a pretty good idea, but why are you weighing in grams and not just popping them on your bathroom scale?
Your bathroom scale could be in grams, but it's just sensitive for you or me, not something that's weighing very little. So you've got to use an appropriate size scale so that it's sensitive enough.
Yeah.
But
So if I was 80 kilos, that's not going to work the same when you've got
80 grams.
80 grams.
Yeah.
And so a kitchen scale would work better.
Kitchen scale, yep. And as they get bigger, we use baby scales, but the little kitchen scales with a little warm bowl,
Yeah.
is good. So we're not going in your house. It sounds like it's a 60-degree bowl. You're going to put your kitten into that. It's like a kitten ice cube. So
It's
warm
not that
bowl.
cold. I wear sweaters. Yeah. But what else have you found? So the nutrition, the husbandry, and I know you've looked at more some specific diseases. What are some of the specific diseases that we find in cats?
Yeah, really.
Kittens, I should say.
We've looked at a few really common things that drive us all crazy. So upper respiratory tract infections in kittens.
That's huge in kittens and cats. Why is it a bigger problem for kittens?
They have lots of issues they're dealing with, as we talked about, poor husbandry. So they may be cold. They may not have the immunity they might have received from their mom if she's vaccinated, and they may not have adequate nutrition, and they're immature. Their immune system may be immature. So they're predisposed to infections like herpes virus infection is really common. And that can make kittens really, really ill.
So what do you see in a cat like that? I know there's respiratory signs, but there's other signs as well too, right?
Yeah. They often have signs involving their eyes. So they may have conjunctivitis, so red, itchy, watery eyes, and they may get ulcers on their corneas, which can be really painful. And they may get an eye infection in the eye, just secondary to that.
And does that have long-term consequences?
It certainly can. I mean, they may lose their vision in that eye and may need to have an eye removed if they have access to a veterinarian, or they may be so sick just from the infection they may pass away. So if they're, it's full of pus and they're feeling sick, they may not eat, and that can be life-altering for a kitten.
Yeah. And I know my center's funded some of this work, but what have you done to try to combat this ocular problem with the eyes? I know you've worked with our ophtho group some. Can you explain a little bit about the research you've done and what you found?
Yeah,
we have treatments for this now?
We do. We did a big study collaboratively. So with myself and the ophthalmology group and then the community surgery group, actually during COVID, which was a very interesting time.
A tough time to do research.
Tough time, but important because none of the shelters were open. So we worked together to do the study, but we also had to provide regular care for these kittens. So it's a time I won't forget, let's say that. So we looked at more than 400 kittens.
That's a pretty good number, especially by veterinary study standards.
Yeah, I thought so.
Yeah.
And it was triple masked. You don't say blinded when you're dealing with an ophthalmology study. I learned that.
You don't want to blind the kittens.
No, so it's a mask study.
Study, okay.
And we looked at the involvement.
Appropriate for the pandemic times.
Yeah, absolutely. And we looked at the effect of a standard of care, which is an antibiotic named doxycycline, as well as topical eye antibiotic and an antiviral famciclovir.
So famciclovir is a drug that's actually specifically made to interact with herpes virus, right?
Yep.
And it's not a cat drug right off. So you're taking, something and repurposing.
Yeah, I mean, there's been some work using it in ophthalmology because herpes virus infection is really common.
Yeah.
But no one has really looked at it in a population of young kittens. We were looking at kittens from birth to 12 weeks of age.
Yeah.
So, and 400 kittens.
And then what did you find?
We found that most of the kittens did really well, whether they received famciclovir or not. And so I think that told us that husbandry is really important, but kittens that had famciclovir had a shorter time to being cured than those that did not get it.
And then, something that we've been talking about also is, I'm jumping us back because, sorry, I jump around a little bit sometimes,
okay.
as our
I can
listeners
follow your
know.
train of thought.
Husbandry. So now it's a term that I know and a term that you know, but can you kind of explain what husbandry means? Because you're almost taking herd health terms and applying them to companion animals, to kittens, not something we usually do. Normally, husbandry, I think of cattle.
Yeah, I can see why you think that. So husbandry is just how they're cared for. So in this study, we trained fosters to make sure that we were, they had a warm environment. They were being fed every so often, being weighed the same way. So they had the same kind of supportive care, I think is what you could consider it.
So that's your husbandry term is what are we providing as a baseline care, not medicine per se, but things in their upbringing.
Right. Yeah. So ideal supportive care for these kittens, they weren't in a shelter, they were in a foster home, being cared for as individuals or small group. So making sure that everybody was doing it the same thing in the same way in all groups.
Okay. And then when we're thinking about this with whether we're using famciclovir in addition to the antibiotics, were there cases where the famciclovir was needed for sure? Or how do you
I mean, it was
that?
So in this group, everybody was randomized. So we didn't make that decision. And so I can't answer that. But the group that had famciclovir had a cure rate that was faster. So, and those kittens that were removed from the study, like we had to remove some because they got worse. Those kittens were not receiving famciclovir.
So it's probably something that's helpful is what you found.
I think so. But for some, because the kittens overall did very well, if there was a situation where the, people couldn't give famciclovir, it's probably okay. But famciclovir does seem to help kittens get better faster and to have less.
Which has value, right?
Especially when we're talking about, as we talked about with OKP, they have 600 kittens a year. If those 600 kittens all have this condition, that's a lot of kittens to get, healthy and adopted faster. So for one kitten, maybe not a big difference, but in a herd,
of kittens,
or a lot of kittens, it makes a difference when we think about them that way.
Yeah. So that's pretty impactful then. And, it provides evidence that this works and evidence that there's benefit, which is important. Yeah. What about nutrition? So, obviously you can't just open a can of cat food for them. What's best to feed them and what have you looked at?
We haven't looked at nutrition per se, but we've been lucky to have industry support so that we're feeding, AVCO-approved kitten diets, so canned and dry food. Purina is what we fed them during the study. So they all had an AVCO-approved diet.
Yeah. In general, though, what do we? That's great. And what do we actually have? one of our episodes is What Should We Feed Our Cat with Dr. Larson, so which people can listen to. But what about kitten nutrition in general? What do you know about that? Not in relation to this study.
Let's see. So I don't know. I'm not a nutritionist, so I don't know that I can answer that. But I think using regular approved diets are important for kitten. Kitten formula is another story in that it's not really regulated.
Yeah.
So I think you just have to, you have to choose a kitten formula that seems to work in your population. Mm-hmm. And, for us, as soon as we can wean a kitten, we try to. So we don't keep them on formula forever. Mother's milk is best in kittens, but if it's not available,
it's not available most
we
of the time
use
with
a
these
reputable formula.
Okay. And there are specific kitten formulas that you can purchase commercially.
Yep, absolutely. So following the recommendations, making sure it doesn't sit in the fridge for 10 days, like my fridge looks like sometimes, is important.
Yeah, obviously, if the food's gone bad, if their main source of nutrition's got bad, you could injure the kitten.
Absolutely, make them really sick. So, yeah.
So I know you've also been looking at hypothyroidism in kittens.
Mm-hmm.
Why is this important in kittens as maybe opposed to cats, or does it have more effects on them?
Yeah, I think one of the pluses about looking at in that famciclovir study that CCH funded, we looked at so many kittens as the primary source. You see other things come out, and as we're looking at kittens' growth in that study with it being a weight every day, we noticed that some kittens weren't growing. Mm-hmm. So that was just something that came about because we wondered what was happening with them. Why weren't they growing? Did they have a liver or kidney or thyroid problem? So I think it's in our literature, it's reported in kittens 6 weeks of age and older. Yet it's a condition that they're born with. I think it's just been under-recognized because we aren't, in our profession, we're not looking at a bunch of kittens that little and looking at them that carefully. And when you do, you see it.
So if a cat is hypothyroid, could you explain it to me? What is going to be the effect on them long-term and particularly for a kitten?
Yeah, in a kitten, sometimes they pass away because their thyroid hormone is needed for every single cell in your body to grow, and they can be really get into trouble. So those that live, they're very small, and unfortunately, they're really cute looking, but they look like young kittens. They have blue eyes, their ears are bent down, they have short, stocky legs, and they can have trouble with constipation, and they're mentally dull. They're not bright and alert and playing, and
so they don't grow and thrive if they don't have enough thyroid hormone.
Exactly.
So they're hypo, meaning too little thyroid hormone.
Yep. And I think a lot of the little guys pass away before we recognize it.
So what are you doing to answer more questions about this or find out what the effect of treating it is? Where are we going with this now that you've identified this problem by looking at a large number of cats and weighing them daily? Mm-hmm. Good husbandry.
Yeah, the first thing we had to do is look at what is normal thyroid. Like we have what is a normal T4 in a kitten?
Well, and a T4 measuring?
Just the baseline thyroid hormone and then some of the central thyroid stimulating hormone, the TSH. So we didn't have normals for kittens. And it may be that, a cat isn't growing, so it may have different levels than a kitten. So
what'd you find?
Yep. Surprise. Kittens have a higher basal thyroid hormone. So we needed to know that.
Because they need to grow.
They're growing.
Yeah.
Right? So we had to figure out that first. So that took a little bit to figure out what was normal in kittens of certain ages. So thank you for that. And then just trying to figure out what formulation and what dose of the thyroid hormone do we give kittens. And kittens need a much higher dose of the hormone, which is called levothyroxine or T4, to give them than, dogs or adult cats do.
Interesting. And so have you kind of, your goal is to then obviously publish this stuff so other people can take that information, right?
Yes.
This is still pretty new. Is it published yet? Or
not published? You sound like the rest of my crew. It's the manuscript is in the works.
Excellent. But this is important information. So it's groundbreaking information, basically, in order to make sure that these kittens who are hypothyroid, how common a problem is this, did you find?
Yeah, I don't know how common it is, but in our group, we have 33 kittens.
33 of 400.
And not in our study group, but we noticed it during the study. So that was in 2020.
Yes.
And since that time, we have diagnosed and treated 33 kittens.
So still fairly substantial. It's not 10% of the population by any means, but
Nope.
it's still enough that this really affects not only the kittens, but even the people who are raising them. If they're not thriving, that's obviously really hard on the kitten raisers too.
Right. It's like a dream where you can diagnose a condition and give them a pill and treat them. There's some things we have to do. They're growing, so you've got to increase their dose as they're growing. And then there's some things to note as they get older. But yeah, it's I love it. It's just, it is a dream in veterinary medicine.
So what else have you been looking at, or what else are you trying to figure out in kittens like that you see as these particular problems that face kittens?
There's so many things, Michael. It's like my desk is littered with things that I want to figure out. One of the things we
like
noticed,
me with cancer questions,
right? Yeah. In the FAM cyclovir study, we noticed that some kittens had a condition called eyelid agenesis, where their eyelids don't form normally. And in the past, our ophthalmology group has had to do a big reconstructive surgery, which is okay for some kittens and some owners, but maybe out of reach for
it's expensive,
very expensive, and sometimes they needed revisions. So we have
to repeat the surgery,
or maybe have their eye removed, which is not also accessible for everybody, or worst case, be euthanized because they have a painful ocular condition. So one of the ophthalmologists, Dr. Sharnock, does some work with laser treatment, and that's something we're looking at right now. Is to do a little bit of surgery and some laser on the eyelids, and
so laser to remove part of the eyelid
just
or
to
stimulate growth. What is it?
Yeah, stimulate healing once it's been removed, so that the eye is a normal shape and the eyelashes aren't digging into the cornea, which hurts.
Yeah,
right?
so the surface of the eye.
Yeah, surface of the eye, exactly. So that's something we're looking at, as a non-invasive way to treat these guys and save their eyes and vision and their lives potentially.
So it's something you notice and something they're trying, and it looks promising. So now you take it to a clinical trial to actually prove it.
Yep.
Excellent. And what else? Anything else there?
So many other things. Wondering about the genetics of eyelid agenesis. We notice it in some other wild cats, like snow leopards. So trying to look at, we notice that some of these kittens with eyelid agenesis, when they're male, they may have a retained testicle. So wondering about the connection there, and if we can figure out the genetics of that in snow leopards, maybe it's something that we can help both populations moving forward.
That's cool. So almost our kittens could be a model for some larger endangered cats.
Potentially, and just working, trying to work collaboratively and together. I'm a clinician, so I'm not doing bench type research, but we can be pretty helpful when we all work together on a problem, bringing something different to the table.
So I know you've recently been involved with the start of a pediatric fellowship here that's been started. And can you tell me why that's important? And do you think we need pediatric medicine to be a new veterinary specialty? So.
I mean, I
Softball
do. I'm
question, I know.
Slightly biased about that. Just as
of course you're biased about it because you're passionate about it. So no, but why is it important, and do we need it?
I think we do need it. We need people who are expert in dealing with day-to-day stuff, taking blood on a kitten. How do we feed them? How do we manage them? And trying to look at how do we do better for them with their medical and surgical needs and their outcome? And I think it can help cats, kittens become cats, and other, maybe it helps puppies. And we have a project on the go with the medical school, working together to help kittens and babies. So that's really cool too.
Looking at what?
Looking at kittens with hydrocephalus and obstructive hydrocephalus. So
can you explain what hydrocephalus is? Yeah.
Yep. So they've got too much water on their brain, and if it's obstructive, the water's not moving out from their brain.
So it doesn't allow normal brain tissue because it's fluid there instead, and it's against the skull.
Exactly. So it's putting pressure on the brain. And so, in the past, those kittens, at least in my hands, have all passed away.
Yeah.
But this is an exciting, treatment to kind of shunt the fluid from being basically in a traffic jam to go around the traffic jam, so they don't need to have like a shunt from their brain into their abdomen.
So basically it will help remove it from the brain and make it more normal and allow the brain to develop.
Yep. Yeah, and save their life if it works. And, maybe for humans, for our human pediatric neurosurgeons, a kitten's pretty darn small, and sometimes they struggle doing these kinds of procedures in small babies. So helping make it ideal for a kitten may help apply it to a baby.
Yeah, that's pretty cool. So what advice would you give to someone new who wanted to foster a kitten, or someone who found or adopted a kitten? What would be the take-home message for them?
So for a new foster, I would hope that they'd be working with a rescue group like the students with the Orphan Kitten Project, where they have a lot of support in trying to make sure things are optimized for their kitten.
So all the husbandry things we talked about.
Yeah, husbandry is really, really important. And, the students are great mentors for each other and trying to work through that. And then they have faculty mentorship as well. But fostering is great because you get mentored through that whole process.
Yeah. And I know you have a website for the OKP project and the like, or at least some links, right, for information availability?
I think they do have a website, yes.
So I think what we'll do, if it's okay with you, is we'll post that with the podcast episode if people are interested in finding out more.
Yeah, that sounds great.
So is there anything I should have asked you that I didn't yet, or anything you want to ask me? Yeah.
I don't think so, but I think, for a long time we've done clinical research in dogs, and cats have kind of, lost out on some of that.
Yeah.
Why? How do you feel about? I don't know why, but I think kittens need some clinical research to be done, so we know how best to do things. So I think time is coming for kittens. We're going to be in that realm.
And with that, time is coming for kittens. So I really wanted to thank you, Dr. Vernau, for joining me today and talking about kittens, all we need to know. And I so greatly appreciate it. Thank you.
Thanks for having me.
Of course. The Vetrospective, as with life, takes a village. I want to thank those who suggested I start this project and everyone who has encouraged and supported me along the way. Particularly, I want to thank our producer and director, Danae Blythe-Unti, Nancy Bay, who is our program coordinator, our sound mixer, Andy Cowett, and theme music was composed and produced by Tim Gehagen. Thank you all, and we'll see you next time.